Brooklyn Independent Television.
The ability to walk upright on 2 feet separates us from other creatures. But putting all that responsibility on just 2 feet means a lot of foot pain for a lot of us bipeds. But as Healthbeat's Kathy Renone reports, having painful feet doesn't just mean you have too many pairs of high heels in your closet. The pain can be a symptom of something far more serious: diabetes.
Heel pain, bunions, tendinitis, and arthritic joints are some of the most common foot conditions that increasingly occur with age. But foot pain can start in your 20s or 30s.
You want to wear footwear that's appropriate. You want to be comfortable for your feet because you're on them all day. You should go into the store and have your foot measured, and then you get the appropriate size that way.
Wearing heels puts pressure on your toes and can cause hammer toes, knee pain, lower back pain, and leg fatigue. And if you're buying a pair of flats, make sure they don't easily bend in.
Your feet should be definitely in a supportive, comfortable place. In other words, you don't want to have a small shoe or a small sneaker or something on your feet that's going to cause you discomfort.
Shoes, no tight, little loose is better. So I use a little loose. If the tight, this also has a problem.
Wearing comfortable shoes is especially important if, like Mr. Ahmad, you're suffering from diabetes. In diabetes patients, feet can be the first part of the body to manifest complications from the disease, like poor circulation and loss of feeling. Both conditions can lead to very slow wound healing and even amputation.
Okay. All right, Mr. Ahmed. It's very important to take care of your feet because of diabetes. You've had multiple surgeries already, and the last surgery is just the amputation due to a bad infection. Now we got it to the point that it's closed, and we put a special dressing on that we use to keep it closed, and that's called Apligraph. Now your job today is to keep the dressing clean and dry, and then we're going to see you back in 1 week in the office.
In the last 3 years, Mr. Ahmad had the big toe and the small toe of his right foot amputated due to infections that started as blisters.
I have a lot of pain when I walk.
You're going to come to the office. So you don't change the bandage, we will change the bandage in the office. And from there, you know, if any as a fever or any type of unnecessary pain or swelling, before the week's up, just give me a call.
Medicare has a program for diabetic footwear, so those who have the disease should see a podiatrist to get their feet measured. Now, Mr. Ahmad wears shoes prescribed by Dr. Campbell.
Diabetic footwear comes with a special insert that it takes to that you put into the shoe that takes a lot of pressure off the forefoot, and that will hopefully eliminate pressure ulcers or calluses.
Every day I go on the beach when foot is okay. Every day. So I know go in this year.
So we have to also check both feet at the same time, make sure there's no problems. And he's a good patient, you know, we just have to, it's very costly, diabetic foot care.
It's estimated that 20 to 25 million Americans suffer from diabetes. The overall cost of foot care in diabetes patients runs about $170 billion per year.
X-rays, the antibiotics, the surgeries, and that just costs the system so much money.
Diabetic foot care requires serious commitment from patients who should check their feet every morning and before going to bed to make sure that there are no abrasions or blisters.
Diabetics over time will develop something called neuropathy, and there's all different types and stages of neuropathy. There's no bathroom surgery, drywall between your toes, again, not walking barefoot, not cutting your nails, using emollient therapy or cream to the skin.
Before you sleep, check your feet, wash it, and then sleep. It's a little wound, so go to the doctor. Because it's going bigger, then I have the problem.
On average, a person walks the equivalent of 3 times around the earth in their lifetime. So take care of your feet. Wearing comfortable shoes can slow the progress of a condition or relieve the pain.
And we'll see him in the office in a week.
Reporting for Healthbeat Brooklyn, this is Kathy Renone.
Brooklyn Independent Television on the BCAT TV network.